To check the cot out initially, push either the plus or the minus button, and a light should illuminate. If it's green, the battery is good. If it's red, battery is bad. Don't be afraid of the cot going up and down because the plus and the minus buttons are deactivated when the unit is in the truck. If the battery needs to be replaced, simply push the red button, slide the battery out of its holder, and replace it with a new one. As the battery snaps into place, the flashing green light indicates that your new battery is good. Some of the features of the Stryker Cot are the same as the old cot. You could still raise and lower the head. There is a little different feature in that you can shorten the cot if it's necessary to go through a narrow area or get into an elevator. And it's a simple matter of squeezing the red handles to release it and slide it back and forth. Most of the cots have got shoulder straps, and you can see how the shoulder straps are hooked up on the cot. Armrest operation is exactly the same as the old cots. The Trendelenburg position can be achieved simply by lifting the foot and released in the way the old cot is. The lifting capacity of the cot is 700 pounds. Okay. When you're ready to remove the cot from the truck, because it is heavier at the bottom end than the normal cot, we're suggesting that you take two people and hold the bottom. Grab the bottom handle, release the cot from the truck, pull it all the way out. When you reach the limit, push the plus button to lower the wheels. Set the cot on the ground and remove it from the truck. When you arrive at the patient, you can use the plus and the minus button to adjust the height of the cot to the position of the patient. To return the cot to the ambulance, push the plus button to raise the cot to the normal height. Because the center of gravity is high, be careful the cot doesn't tip over, and then return the cot to the ambulance. When at the ambulance, ensure that the cot is hooked on the truck, and then the two people return to the bottom of the cot to lift, okay? Take the weight, making sure that you don't strain your back, lift, and retract the wheels, and insert the cot into the truck. By having two people on the foot of the cot, that ensures that there will be less back strain. When you reach the hospital, you can adjust the height of the cot to match the height of the gurney in the treatment room. Simply lower the cot to match the height, which will then make transferring the patient to the gurney much easier. If for some reason that the electrical portion of the cot fails to work, you can override the electrical portion by pulling the override handle. It's possible to raise and lower the cot manually, and the legs will fall down by themselves. Releasing the emergency handle locks the legs in the position they're at. So you can raise and lower it with the emergency handle. Should the cot be stopped on a hill, you can lock one wheel simply by pushing on the wheel on the toe brake and the cot will remain. Please don't leave a patient on the cot on a hill with the toe brake on. To release, it's a simple matter of pushing the top of it and the cot will roll again.